Well, yesterday we hit a number of daily reported coronavirus cases here in Arizona that we have not seen since July. And today, sadly, we topped that number. So let me get you the updated numbers from the state health department coming in just a short while ago to our newsroom. 4,471 new cases were reported in just the last 24 hours. And that takes our state total now since the start of the pandemic past 290,000. And we are inching closer to a grim milestone of 300,000 cases. Now, if we continue to see this daily trend, we could hit that number by Thanksgiving. And we're also learning 43 more people have died from coronavirus here in the state of Arizona. And that means now 6,427 Arizonans have lost their lives because of this virus. More than 27,000 new tests were reported, which is higher than we've seen in recent weeks, possibly because more people are getting tested before they head out for the holidays. But our average weekly positivity rate still holding at 12% now. That is the highest average we have seen since July. So the surge in cases is having an impact on our hospitals, no doubt about it, especially the ICU. So we're going to dive deeper into those numbers. We will give you an even closer look at the numbers, the hospital metrics in particular, coming up in our 9 o'clock hour.
You're exactly right, Gina. So the frontline workers, the doctors, the nurses, they're the ones seeing firsthand what the second wave of the pandemic is doing to our hospitals. So to get a perspective about what they're dealing with right now, we're joined by Heather Jordan. She's a nurse at Valleywise Health Medical Center. And first and foremost, I want to ask you, as well as the nurses and doctors and medical professionals, how are you guys holding up right now?
Hi, good morning. We are hanging in there. We know we have a tough job ahead of us, and we know that each day is going to bring a new challenge as we continue to see these cases rise and see these patients become sicker, as we did with the first wave of this pandemic back in the late spring or early summer. The trends right now are following exactly what we saw during that first wave. So we know we have a tough road ahead of us, but we all know that this is the job we signed up for, and we're here every day ready to take care of patients and do the best we can.
We know you guys do an amazing job, and there have been a lot of strides taken since the beginning of the pandemic. Are you seeing patients who are less severe or headed in that direction that wasn't good that we saw in the beginning of the pandemic?
When we first started seeing the second wave, we were seeing patients who were less acutely ill than we were seeing towards the end of the first wave. But we're definitely following that same pattern that we saw in the first wave, where we're starting to see more and more patients go to the ICU and more patients get sicker and sicker as time goes on. So I think what we're seeing currently in the hospital, in our ICUs as well as in our med-surg areas, is following exactly that trend we saw earlier. Patients come in less acutely ill, and as we get deeper into the second wave of this pandemic, they're getting more and more sick. So that is absolutely putting more patients in the ICU and causing more stress in those intensive care units as that volume grows.
I know as the cases surged here in Arizona over the summer, we were pulling resources from other states. But as we're seeing the spike across the entire nation at the same time, are you guys concerned about those resources, and what measures are in place so that you guys don't go through burnout?
Resources are always a concern when you're going through a pandemic, where you're going to get the staff to take care of patients who are in the hospital on top of your regular patients who are normally there. So wintertime, our volume usually goes up anyways with respiratory and flu season, and now we add a second wave of COVID-19 on top of that. So resources are always a concern. Currently at Valleywise Health, we are able to staff to the volume and acuity of patients that we have in-house. So we feel fortunate that we can say that, but as we get deeper into this pandemic, we do know that resources could be stretched thin, and it doesn't appear that there's going to be assistance coming from other states as we had before, because as you said, the entire country is surging at the same time.
Just really quickly, what is your message to the public?
Oh, we, especially coming up on this Thanksgiving week, we fully understand that everyone wants to spend holidays with family, and we want to do that as well. But at the same time, we'd like to encourage everyone to just be smart about the choices we make and spend time with your family, but do it in smaller groups maybe than what you normally would. And if you're going to have a larger family gathering, host it outside where you're in open air rather than in the confines of the indoors, and social distance and wear your mask as much as you can. Those are the only things proven so far to really make a difference in this pandemic. And we just want to encourage everyone to continue to do that. Wear your mask when you're out in public, wear your mask when you're within 6 feet of anyone, and then try to social distance as much as possible.
We thank you very much for all that you do. Our hearts and prayers continue with you and all the medical staff across the valley and across the state. So we thank you, and we wish you good health.
Thank you so much.